didn't you send me the questions before?
I think it should be, I don't want you to be ready.
Do you want a good show or you want...
Hi everyone, welcome to my channel. Today I'm here with the lovely Maria, but like those who don't know her personally can call you Dr. Maria, right? So Dr. Maria.
Yes.
Perfect. So I'm not gonna say much because the first question is, tell us a little bit about yourself.
Okay, so which part do you want?
Let us
social side, the professional side.
Just blow our minds away.
That's very funny. Okay, so I'm Maria Akani, as you know. I'm married. I have 2 children, and I'm a psychiatrist and a psychologist. The essential thing about me is that I love life, and I believe that we should not live life in a quarter. We should explore it to the full. Because it's a gift to us. So I really believe in exploiting whatever opportunities, whether it's relationships, whether it's being in a space, whatever it is. I try to make sure that I go away with just what was supposed to be there, for example.
And so that it's less heavy, tell us 3 random fun facts, or it could be like 3 random facts about you that we wouldn't know when we just see you.
Random.
I know this will be easy because you did your 40 day social media info. So tell us
some random things about me. Yeah. Well, like for example, I can't go to sleep without socks. I always sleep with socks. And if I don't sleep with anything else, I have to have socks.
Even in October?
Yes, I always have to cover my feet. I just can't go to sleep if my feet are not covered up. That's one. The second thing is I do not watch, I only watch TV when I am absolutely tired and I've got nothing else to do.
I see.
Yeah, because then I feel like, it's a wasted 2 hours sitting an empty space doing nothing.
I can't relate, but I'm agreeing because I get it. Ish. Okay.
Yeah, I mean, when I think about it, it's like you're just sitting there and time is just passing away, if you know what I mean.
I get you.
So if I'm tired, then I'm good for nothing anyway. I can watch TV.
But not I'm now watching TV.
Yeah, no. It's like I'm stealing space out of my day, so that's not going to happen. I love reading, and my favorite time to read is on the plane. Yeah, so I read a lot of books, especially in the last couple of years. I've read so many books, and part of it was because I was catching up after having been in med school and school so long. Then I'm just done with academic books and just really trying to read a lot of novels and fiction and things like that. So yeah.
Thank you. Okay, so we understand you said you're a psychiatrist and psychologist.
Yes, I am.
So are you able to let us know what triggered your interest in mental health?
Actually, it was more of a self-discovery thing. So it's having an interest in something and not even knowing that there's such a thing, if you know what I mean. Yeah, so I've constantly been the kind of person that's curious about what makes people do things, what motivates people to do things, and talking about pain and difficult situations, like having difficult conversations. And so I would be the person that would ask you, why are you crying, when everyone else is afraid? Like, she looks like she's crying. But they're scared to ask.
I get you.
So right from when I was at school, I would be the person that would just come up and say, so why are you crying? Do you want to talk about it? And things like that. So then out of my own interest, when I graduated from high school, I decided to do a Christian counseling course at Evangelical University, and totally loved it. But it was just for my own personal benefit, in the fact that I found myself at this space where a lot of people shared with me, and I wanted to equip myself in doing that. And then later I went to medical school, convinced that I'll become a pediatrician. First a gynecologist, and then I don't know if I can say this here, but anyway, I could not stand the smell of placentas. Like, I can only have so much of
see.
them. So after that, I just said,
Really?
no,
No.
I cannot spend all my life here. So I started thinking about PIDS. And when I came to my psychiatry rotation, I was like, oh my gosh, this is like the stuff I'm interested in. And then it's in medicine, you know. And just the whole pathophysiology thing, the history taking, how that building rapport is the most essential component of giving mental health services. That just was like something that just called out to me. And so I found myself at this place where there was something that was fit for me, and I just found myself getting into, so it worked out really well.
I see. Okay, that's great. So we're now going to go into the mental health aspect of it, mental illness. So are you able to tell us what it means to have a mental illness?
Okay, so I usually think that before we explain what mental illness is, it's important to explain what mental health is.
So is there a difference? That's actually, I was trying to prepare the questions, and I was like, initially I was like, okay, what is mental health? Then when I was researching those mental illness, so is mental health a part of mental illnesses?
So let me maybe remove the mental aspect. That's the best way to understand it. So when you remove mental, you remain with what? Health?
Yes.
And then when you remove mental and illness, you remain with illness. So you remain with health and illness.
Yes.
So essentially, what is health and what is illness? That's what we're dealing with. Except that now we are discussing it in terms of mental.
I see.
Yeah. So when we talk about mental health, we talk about a person's ability to think, feel, and act. Okay, so essentially who they are, how you see life, how you interact with people, how you make choices, your feelings, your thoughts. And that's one of the reasons why when you are not having sound mental health, we refer to you as you are not yourself today.
I see.
Yeah. So when we talk about mental health, we are essentially referring to you as a person, you as Mwape, what makes you who you are, how you interact with the environment, and so on. When we talk about mental illness, we are saying that there is a disruption in that.
Okay, I see.
So the health has been disrupted, and now you're getting to the illness part. And then there's two things about that. So when we talk about physical health, there's essentially a time when you are sick and you have been diagnosed with an illness. And then there's times when you're not sick, like no one can diagnose you with anything, but you're not well.
Okay.
Yeah. And then there's the health part. In mental health, we also have a spectrum like that.
Okay.
So there is a sense in which when you're healthy, you're really growing to your full potential. You are exploiting who you are interacting well with your environment, you can apply yourself in your work, you can do your self-discovery, all those things are working out real good. But when you are unwell, you may be at a point where you're distressed, you have a lot on your mind, you can't function fully, you are not bedridden, but you can't function fully, you can't concentrate, something is on your mind, something is disturbing you. When we talk about mental illness, we're talking about a diagnosable condition.
Okay,
Yes.
I get it. Okay. So if I ask you what are the forms of mental illness, is that okay, or should I say what are the forms of mental health?
No.
It's
Mental
mental
health.
illness, hey?
Mental health is health. It's
Okay,
like
great.
asking me,
Okay.
what are the
I
forms
get
of health?
Okay, so what are the forms of mental illness?
There are actually quite a number.
Okay.
So I'll try and
The
mention
common ones.
Yes, I'll
Okay.
try and mention the common ones. So we have groups of them, and like I said, when we talk about mental illness, we're talking about diagnosable conditions. Okay, so there's things like anxiety disorders, and primarily the symptom in there is anxiety.
Okay.
So the person is anxious sometimes about everything. Sometimes they have what is called panic disorders, where a person really feels like they're dying and so on. Then we have mood disorders, which are divided into two groups.
Okay.
There's the depressive ones, where a person is with the primary symptom there is sadness.
Okay.
Yeah, so a person is withdrawn, they cry, they're not motivated to do things, they may have poor self-care and so on. Then there's also the bipolar ones, which is the primary symptom there is a hyperactivity kind of symptom where a person is disorganized.
Okay.
They're supposed to be happy, but they also primarily have some sadness, so because of that they have like super energy, they're not able to sleep and so on. In children we have the common ones are things like autism. Then we also have things like ADHD, attention deficit hyperkinetic disorder. Then we have conduct disorders, which are basically to do with behavioral problems with children and so on. So there are also some conditions which are first diagnosed in childhood. Then with adults, in Zambia, one of the common problems we also have is alcohol-induced disorders. So
I've never heard of that one.
Oh, really?
Never.
Okay. We call it substance-induced disorders.
Okay.
But then the substance is usually what defines the condition. So you have alcohol-induced disorders where people can have depression or anxiety disorders or panic. So it's called alcohol-induced depressive disorder or alcohol-induced anxiety disorder, and alcohol-induced psychosis. So different things that come with the fact that you have the alcohol. And then the same with cannabis. The same with the amphetamines. I don't know if you've heard about amphetamines. Okay. Anyway, some of the things that are common, I think, on the streets is the children who you see smoking glue and so on. So there are disorders that come from there. So all the external substances, they can result in disorders, and we primarily call the disorder based on the substance they use. So if a person uses more than one substance, like cocaine, heroin, cannabis, we call it polysubstance abuse disorder.
I see.
Because there are several substances. Then we also have other disorders that have to do with sexual disorders.
Really?
So, yes. We have sexual disorders. Some of them have to do with the actual sexual function. So maybe things to do with the desire, the arousal or something. And sometimes it's about having sexually deviant behavior and so on. So all those come under
I didn't know.
mental health disorders. Yes. So yeah, people were wondering why I was talking about sexual health at some conference, and primarily because, you know, disorders to do with sexuality are also classified under mental health disorders, because it's who you are as well. You know, there's a huge component of the mind when it comes to sexual activity. There are also disorders to do with psychosis, disorders called schizophreniform. You've heard about those disorders. Yeah, it's one group of disorders as well that is dealt with. And then there's also the disorders that have to do with physical symptoms. So, for example, I don't know if you've heard about hypochondriasis.
No, I don't think so.
Okay.
No.
So in that condition, a person is convinced that they have a physical condition, and they'll keep going to the doctors saying, you know, I have this condition. They'll be investigated and found there's nothing.
But they're convinced that they
have. And they actually feel symptoms. Also somatization disorders, because in that particular disorder, a person may have a form of stress somewhere else, and then it then comes out in the physical form. So if you sort out their psychological problem, the physical problem,
I get you, is okay.
Resolves. So you have those. And then you have also the dissociative disorders. These primarily happen when somebody has either neurological conditions like epilepsy, so they'll go into a dissociative state where a person goes into, like, a person can actually leave home, not know that they're going home, not know that they've left home, go somewhere and wander off, not knowing who they are and can't remember who they are and things like that. But sometimes those things happen when a person also experiences severe trauma.
Okay.
Yeah, so they go through this state where they may totally have no recollection of a huge component of who they are, you know, like maybe you only remember Mwape at 18. And as far as you're concerned, you know, grade 12 or something, and you're supposed to be dealing with this, and you can't understand.
Oh, I see.
Yeah, so even those disorders are related to psychiatry, because, you know, remember what we talked about, mental health has to do with how a person thinks, feels and acts. So the person is feeling things, is acting in a certain way, and is also thinking a certain way. So then we deal with those disorders. And you can see how I guess I'm preempting some of the stuff.
Can you just summarize at least 5 general causes?
Okay,
or
so
3 or 5 general causes?
yeah, I can mention some of them, and I think one of the commonest one is also infections, because infections affect the brain. So the brain structure itself is affected, and sometimes infections can injure the brain to an extent that they affect a person's mood. So the areas which affect mood, or the areas which affect judgment, like the frontal lobe, the areas which affect things like hearing, so they start hearing voices and seeing visions and so on. Yes.
From an infection?
Yes.
Okay.
So common infections include things like HIV, syphilis, hepatitis.
They can mess with your mental...
Oh yes, and actually the virus loves neurons. So you find that when you have HIV, there are a lot of neurological symptoms, because for whatever reason the virus likes to multiply and stay in the neurons and nervous tissue.
Wow.
Yeah. So that's infections, that's one. There's also trauma, the actual trauma, physical trauma. So not psychological trauma, but physical trauma. Because when you have an accident, you bang your head, certain areas of the brain. If you've had a fall or head injury and so on, those things can affect the brain. Yeah. Then the other thing that I think a lot of people think about is now the trauma, the psychological trauma.
Yes.
So problems that people may be having, psychosocial pressures and so on, they can affect because they require the brain to work at a certain energy level, which may be too much for it, and it can decompensate and get to that point where there are neurotransmitter imbalances and so on and so forth. The other thing I already spoke about was drugs, because drugs will alter how the neurons work. The body works really, not just the neurons. And so because of that, you may end up with those kinds of things. And genetics. So genetic predisposition, you find that sometimes some of these things run in families, inherited. So because of that, the likelihood of someone getting a condition.
I see. So sometimes you hear people say depression runs in my family. So you mean like that?
Yes.
Okay.
Yes.
Okay.
So
that makes sense. And then, are you able to help us with some of the warning signs or symptoms, and do they vary depending on stage of life? Like, are the warning signs different in younger children, teens, and adults? Are the symptoms the same in general?
I think they're different, especially for children, because children, first of all, a number of times are not able to name their feelings.
Okay.
So you find that a lot of the symptoms are behavioral in the sense that maybe a child will just withdraw. They might regress and start bedwetting if they were not bedwetting before. Their appetite may just go down. They may be constant complaining of abdominal pains, which might be really an anxiety disorder because they don't know how to explain that it feels like in my stomach. So you find those things, or headaches and so on. So, and sometimes irritability, the child suddenly can't sleep at night, they are fearful. Yeah, so those are some of the things you see in children. In adults, sometimes you see anger, irritability, which you can't explain. Yeah, sometimes it may be a sign of depression or something, but sometimes it's just seeing a behavior change. A person who was previously quiet is talking too much, and they're giving away everything they have, money, books, whatever, trying to sell their car for a song, just things like that, so there's something going on here, and sometimes the person may not even be able to know that there is a problem. And sometimes it's more insidious, so it may not be overt and big, like something very dramatic happens. It may just be over time, and somebody close to them may say, this person has changed. I've been seeing them the last year or so, and they've just changed. They've changed the way they dress, they've changed their friends, they're more secluded, they're not answering their phone and things like that. Or they might just be saying really bizarre things, really bizarre things which can't happen, but they will explain them, for example, the OP are suddenly following me. They put a camera in my car, and there's one in my phone, and they put a device here under my thingy, and so I can't really talk to you because they can hear us. So things like that.
Okay, that's okay. And any possible ways to avoid or prevent mental illnesses?
Yes, definitely. One of them basically is what we call self-care, being able to manage yourself and care for yourself properly. Because remember, we talked about how mental health affects the way you think, act, and feel. Okay, so if there's an imbalance in those things, that's when you end up decompensating to that level. So there's things to do with just lifestyle in terms of managing stress, how much stress you manage, whether it's your relationship, whether it's work, whether it's your money problems, just being able to manage those. Things to do with diet, because your brain gets its nutrition through the food you eat. So being able to eat healthy will affect your alertness and your mood as well. Then also to do with alcohol and substances that you take. If you can prevent them altogether, then you'd have prevented certain harm coming to your brain. Then when we talk about also self-care, it's not just a matter of existing, it's a matter of also being able to thrive. So having dependable relationships that can give you support, having meaningful contributions in society, so being part of a community, something that motivates you, something that keeps you going, so that even when hardships are coming, that thing that keeps you going will keep you having your resilience, and you keep motivated in that aspect. Having goals and being able to have accountability as well, those are things that help you to grow as a person, and so on. Love, very essential for mental health. I don't know why you laughed about that, but yeah, very essential.
Yeah, no, I agree, it's very essential.
Very essential for mental health. And romantic love, yes, is great, but even just unconditional love from or love that you give to a sibling or a friend and so on, those are important aspects. Adequate sleep as well, because your brain needs to repair and rest and recuperate, so you need to have adequate sleep, adequate hydration to clean out your body, because that's the blood that is also reaching your brain, and so on. Exercise, because it improves circulation to your brain, it improves your alertness, it releases endorphins which elevate your mood, so that's important.
And then what treatment options are available in our country?
So do you mean recommended ones, or
is there room for mental health in Christianity? You hear some Christians in our culture tell you to seek Christ when you talk about struggling with mental health. So does seeking therapy or counseling mean you're implying Christ is not enough?
So one of the things I think you asked me was, can we just pray for mental health problems to go away? And one of the things I said is,
why do men tend to have difficulties talking about their problems? I know according to statistics, men have a higher suicide rate than females do. So any special word for the men out there?